Some his brains, Doctor.
No, that's just dried blood. Those are his brains.
Today, we're diving into the world of medieval surgery. You know, long before the advent of anesthesia, when, as I'm sure you can imagine, operations were an extremely painful ordeal. The three procedures we're going to examine today were all performed long before 1846, when a young Boston dentist, one William T.G. Morton, discovered that diethyl ether provided safe and effective anesthesia when inhaled. Before that, just bite down on something. As usual, any depiction or trauma displayed in this video is reenacted for educational purposes and carefully contextualized within a lesson on human anatomy. First, we'll visit Mark, a medieval barber, at the Chalk Valley History Festival to hear what he has to say about limb amputation.
It's the most gruesome thing I've got in my armoury. Fleshing hooks like these can't go through the bones in the medieval period. If we do that, chances are you're going to get infection. So what you're doing is going through the joints.
Haha, the good old fleshing hook. We're off to a strong start. Right, so this is one of the tools used historically in the limb amputation process to cut through various soft tissue, epidermis or skin, fat, and muscle, to expose the target joint capsule and its associated ligaments and tendons.
Through the soft squidgy bits, and then to get through the joints, a saw like this one, or a chisel just going straight through that joint.
Ouch. I mean, yeah, sometimes I jokingly refer to myself as a carpenter of the flesh, and this is why. Even today, the tools I use bear a striking resemblance to those you might find at a construction site, albeit a little less rugged and a little bit more precise.
After these messages, we'll be right back.
As a science-based content creator and lifelong learner, my channel is all about teaching you, the interns, about science and critical thinking skills, the study of which often take many years. Or at least it used to. Now, there's a better way to learn about science and to develop critical thinking skills that doesn't cost thousands of dollars or take years of schooling. In fact, it's actually free and super freaking easy, bro. Today's sponsor, Brilliant, is one of the best ways to learn math, computer science, and data science skills interactively. And if you want to be able to learn about a topic and truly decide whether the information is valid, then you should have a grasp of how to understand data. Brilliant makes learning about science fun and interactive. There are thousands of lessons that range from basic to advanced topics, and new lessons are added every month. And regardless of your skill level, Brilliant customizes your content to fit your needs and lets you work at your own pace. One of my favorite courses is the Data Analysis Fundamentals course, where I practice analyzing real data and drawing insightful conclusions from it. The kind of analysis that forms the backbone of much of my content. You know, thinking critically like a surgeon. And you can start right now. To try everything Brilliant has to offer, free I might add, for a full 30 days, visit brilliant.org/Dr Chris Raynor or check on the link in the description down below. The first 200 of you who visit will get 20% off Brilliant's annual premium subscription. Now, Mark mentioned that going through the joint would decrease the likelihood of infection, which is true. Marginally, as an amputation at the joint capsule leaves the adjacent long bones closed. This is important because bones are actually living tissues made of cells and minerals, constantly renewing themselves and even have blood vessels supplying them. If a bone is cut open, more of this process is exposed to the outside world and bacteria could easily get in, causing a severe infection called osteomyelitis. This infection can destroy bone and even spread throughout the body, becoming life-threatening. But let's be real. Infection was very likely after any medieval surgery. I mean, medieval surgeons didn't even wash their hands, bro. No, seriously, check this out. This is a reprint of an article entitled On the Antiseptic Principle in the Practice of Surgery, written by Dr. Baron Joseph Lister in 1867. In short, Dr. Lister used a spray containing carbolic acid, or phenol, on wounds, wound dressings, and surgical tools. Then he went the extra mile and washed his hands. His method reduced the incidence of wound sepsis and gangrene, which in turn reduced the need for amputation. Go figure. In 2024, this seems freaking preposterous. And while there is no comprehensive data on the incidence of infections in surgical patients prior to the antiseptic revolution in the 1860s, historical records and accounts do suggest that post-operative infections were a significant problem during that time. It's all the more ironic when we consider that aside from acute injury, wound sepsis and gangrene were common causes of amputation. Trading sepsis for, well, more sepsis? No, thank you.
And afterwards, a cauterization line to sear that flesh.
Bless these surgeons. Well-intentioned, but damn, is this ever primitive. Cauterization would have been performed with a hot iron or heated instrument as Mark demonstrated. The hot iron would be pressed onto the wound to burn the tissue, causing dehydration and shrinkage, creating a tightening effect. Simultaneously, it forms a seal by denaturing proteins, which helps control bleeding and closes off blood vessels. Nowadays, we use a technique called arterial ligation, which is the process of tying off or closing a bleeding artery to stop hemorrhage with sutures. And although we do in fact still use an electrocautery device to cauterize small vessels, anything of notable size is getting tied off or even clamped. Now, by some accounts, arterial ligation was around in and even before the medieval ages. But while some skilled physicians may have been aware and capable of performing said procedure, it may not have been universally understood or accessible. Despite its risks and limitations, cauterization would have been a more straightforward and accessible method for many people.
All right, let's get her done.
Okay, fire in the hole.
Go.
By the 1800s, however, arterial ligation became more widespread. Here's what it may have looked like then.
And you use one of these just as a tenculum, and then you dig around, pull it out, slip it over, tie it off, and then release the tourniquet.
Mind you, in the early 1800s, we're still 50 years out from anesthesia, which means many patients would have had surgeons fishing for runaway arteries in raw flesh with what amounts to be a mini hooked needle. But after the fleshing hook and bone saw, it's likely these patients were far beyond their threshold for pain and either in shock or teetering into unconsciousness. You can now see why speed was such an important factor in the amputation procedure, to minimize the patient's time in pain. Easier said than done, as there is a lot to do. Think about it. Joints generally have multiple tendons and ligaments that provide support and stability. And while the exact number varies based on the joint's complexity and function, even the simplest joints, the hinge, think knee and elbow, have at least 3 in the elbow or 4 in the knee, primary ligaments and several tendons that cross them. Blood loss, though a concern in lengthy surgeries, can be limited sufficiently by a correctly applied tourniquet with appropriate pressure. Either way, saw, chisel, whatever the tool, surgeons needed to be fast. Ever heard of Robert Liston? Over the course of his lifetime, 1794 to 1847, he became renowned as the fastest surgeon around. According to an article by Alan J. Hawke, one contemporary recalled of Liston, when he amputated, the gleam of his knife was followed so instantaneously by the sound of the bone being sawn as to make the two actions appear almost simultaneous. By the time Liston was performing amputations in the early 1800s, he was willing to saw through bones, whereas medieval surgeons some 400 years earlier went primarily through the joints. And while this was still before the advent of anesthesia and proper antiseptic procedures, Liston's surgical toolkit looked far more advanced. Pictured here are Liston's Catlin knife, top to cut flaps of leg muscle in preparation for limb amputation, as well as his bone forceps, bottom, to cut away bone fragments, and the spicule after the limb had been amputated. Oftentimes, during a speedy amputation procedure, the bone breaks off once the surgeon is almost completely sawn through, leaving a spicule that could cause post-operative irritation within the stump. And a spicule is just a small spike-like piece of bone tissue, similar to what might happen when you snap a tree branch and it breaks unevenly. The forceps were designed to remove that sharp edge. And I am sure you've heard me say many times that bones are great in compression, but they suck in rotation and they really don't like bending either. Liston also had a knife named after him, the Liston knife, a large, straight surgical blade historically used for, as I'm sure you've guessed already, rapid amputations. Similar to, but much larger than the Catlin knife, used for more precise cuts.
Liston knife. This is it.
Thankfully, today's tools are much more refined and precise. Any guesses as to what everyone is looking at?
Some his brains, Doctor.
No, that's just dried blood. Those are his brains.
What we have here is a trepanation procedure, which is an ancient surgical practice of drilling or cutting a hole into the skull. It was historically used for medical, ritualistic, and mystical reasons. Can you imagine paying a visit to the village doctor for a persistent migraine and the next thing you know they're drilling a hole into your head? In ancient times, it was believed to treat various conditions such as head injuries, epilepsy, migraines, and mental illnesses by allowing evil spirits or pressure to escape from the head.
Trepanation is a very ancient practice of drilling holes in one's head.
In some cultures, it was also performed as a part of initiation rituals or for spiritual reasons. Today, doctors may need to perform a similar procedure called a craniotomy in some cases, which involves removing a part of the skull to allow access to the brain. Under specific medical conditions such as exploratory diagnosis, relieving intracranial pressure due to epidural or subdural hematoma, debriding a penetrating head wound, and gaining access to the brain. However, craniotomy differs from trepanation, which creates a permanent hole in the skull, as the original piece of skull bone will be replaced.
Can I have the coin, please? Sorry.
As demonstrated by the ship's doctor in the film Master and Commander, coins or other pieces of metal would be drilled into the skull to cover the hole. Just imagine how many unwashed hands have touched that coin. Can you say infection? Furthermore, I sure hope the seal is airtight since the skull is filled with cerebrospinal fluid, in which the brain essentially floats. A loose seal would allow CSF leakage between the skin, which would have been sewn shut over top of the metal, and the skull during the healing process. And since cerebrospinal fluid plays several important roles, protective cushion, shock absorber, and waste removal system for the brain and spinal cord, no amount of leakage is a good thing. Believe it or not, cranial trepanation began to be performed more than 5,000 years ago in Europe and as early as the 5th century BC in the New World. And many survived to tell the tale. Every now and then, ancient remains turn up with trepanations that showed evidence of healing, indicating survival.
You can see if the person lived after the trepanation.
Because the bone grows.
Yes, and softens.
This scene from the film Rome depicts what this ancient surgery may have looked like. It is a testament to the resilience of the human body that many survive this procedure, despite the risk of infection and further complications, not to mention the overwhelming pain. Here again, we see the administration of a metal plate with nails and a hammer. Now, the body does have a remarkable ability to repair and regenerate bone tissue to some degree through a process called osteogenesis. And if the metal plate was left in place for an extended period of time, it's possible that the surrounding bone tissue would grow and eventually integrate with the metal plate to some extent. Amazingly, bone tissue can grow and remodel around foreign objects such as metal plates, especially if they are biocompatible. But I doubt our ancestors were too concerned with biocompatibility. So please temper your expectations. We're talking about maybe a millimeter or two at the edges of the metal plate. In an article in the Archives of Trauma Research, Dr. Mohammed Ghani Arani explains, officially speaking, trepanation discovery dates back to Paul Broca, Victor Horsley, and the era of Hippocrates. But some archaeologic findings have revealed skulls that were trepanned thousands of years BC all around the world. Apparently, the history of brain surgery dating to the Neolithic age was often accompanied with trepanation. For those unfamiliar with the term, the Neolithic period, or New Stone Age, is characterized by the beginning of a settled human lifestyle. And our Neolithic ancestors just didn't have the resources to properly cover the skull. A wound dressing was likely administered with some form of crude suture or thread to assist the wound healing. This also would have been before the time of drills, metals, and other complex hand tools. This human skull illustrates different methods of ancient trepanation, with flint scraper on the left and obsidian on the right. Or here we see trepanation with a flint-pointed bow drill. All of these methods are horrifying. Can you imagine someone scraping away at your skull for an hour or so? with a piece of stone, no less. And yet, no matter how archaic this seems, there are injuries that would lead to death if left untreated. Better to have a piece of the skull removed than to have a depressed or comminuted cranial fracture tickling the surface of your brain. Likewise, sufficiently elevated cranial pressure is quite problematic. Severe headaches, vision problems, nausea, and in extreme cases can lead to brain herniation, coma, or even death if left untreated. I'm not sure how archaic doctors would differentiate between an average headache and one caused by a brain bleed, but hey, that's neither here nor there.
My name's Kevin Hicks. Welcome to my YouTube channel, The History Squad.
Some of you may already know where this is going, as this particular video and surgical technique has been requested many times in the comment section of various videos. Shout out Kevin from the History Squad, who just happens to be an expert on, well,
how they survived arrow wounds in the medieval times. Let's get stuck in.
Similar to modern firearm projectiles, arrowheads vary in design for specific purposes. Barbed or spiked ones cause wider wounds for hunting and lightly armored enemies, and once they're in, they're not coming out. At least not the same way that they went in.
How about that for a broadhead? So if your horse is hit with that, it's just going to be absolute agony. If you're hit with it, it's going to be agony.
The design of the broadhead with spiked edges ensures that it cannot be pulled out of its target without heavily exacerbating the damage sustained by the target. Alternatively, straight points, known as bodkins, were sometimes used in battle to pierce armor more efficiently. Kevin, can you show us an example?
This is quite a heavy bodkin. It's a nasty piece of work because it can smash its way through the padding and through the chain mail, dent armor.
Although bodkins had very high penetrating power, their straight tip made it possible in some cases to pull them out the way they went in. So when you hear stories about arrowhead removal, this is likely the type of arrowhead mentioned.
It wasn't an arrow with a barb or spikes on it, because you'd never get that out the head. You'd have to push it all the way through, so the chap would probably die.
And I mean, that's a tad less than ideal. So there you are.
Minding your own business on a battlefield and somebody like me shoots you. It's not been cleaned, may have even been in the dirt, could have animal feces on it.
I wonder what the incidence of infection was for medieval people subjected to trauma, or surgery, or both. Nothing we have covered today sounds very sanitary. Even a shallow wound from an arrow carrying enough bacteria could create problematic infection. You may even be lucky enough that
your friends see you go down, it's a shallow wound. So they pull the arrow out, it's come out complete. Excellent.
But you're still in grave danger. When bacteria enter a wound, they can multiply, spreading throughout the body and trigger an overwhelming immune response. This response, meant to fight the infection, can instead cause damage to tissues and organs, potentially leading to sepsis, where the body's response to an infection causes widespread inflammation, leading to organ damage and failure. Not to mention what comes next.
So they bandage you. Not with a nice clean bandage like this. This is for the film. They will rip a piece of cloth off your clothing.
You can imagine the dirt, blood, mud, maybe more animal feces on that bandage, all types of bacteria right in the wound. You're between a rock and a hard place, really. You wouldn't want an open wound on the battlefield, and the bandage might be necessary in order to slow blood loss, depending on where the arrow penetrated. It might easily sever or penetrate an artery somewhere, putting you at risk for hemorrhagic shock, which occurs when a person loses a lot of blood quickly. The loss makes it hard for the body to get enough blood to vital organs like the heart and the brain.
Now, it's down to the doctors, the surgeons, who are gonna fight the infection for you.
Historically, for this purpose, various things might be applied.
Now we do know Henry V stockpiled verdigris and sal armagnac.
And having survived an arrow through the face, Henry V has plenty of first-hand experience. So verdigris, made from copper acetate, was historically believed to disinfect wounds, while sal armagnac, ammonium chloride, was used as a disinfectant and astringent. They were applied topically to wounds for their perceived antiseptic properties, although their effectiveness and safety were limited compared to modern treatments.
And we know that castles stockpiled honey, not just for food, but they had a separate store of medicinal honey.
Believe it or not, honey has been used for ages in wound care because it has natural antibacterial properties. It keeps wounds moist, inhibits bacterial growth, and aids healing.
Honey
It's flammable as fuck. Who knew?
Its high sugar content draws moisture from the wound, creating an environment less suitable for bacteria. Some types of honey also contain hydrogen peroxide, adding to its antibacterial effects. In modern medicine, medical grade honey is sometimes used even today in wound care for its potential to promote healing and prevent infections. And let's not forget,
They had wooden dowel with linen wrapped around, and this was dipped in turpentine, and they would push this into the wound to keep it open.
here, the belief was that keeping the wound open would allow it to drain, prevent infection, and promote healing. However, while the intention might have been to facilitate drainage, it often led to further tissue damage, increased risk of infection, and prolonged healing. Not advised, and we don't do this today. Turpentine, an oil-based solvent made from the resin of certain pine trees, can cause irritation, redness, and even chemical burns, especially if it is used in high concentration or if the region is very sensitive. Let's hope the actual arrow removal tactics were better than the wound management techniques.
I'll just introduce you to a few of the tools that they use to pull the arrowheads out or push them all the way through from a person's body.
Hooks, knives, scissors, etc. As you can imagine, to create enough room in the flesh to unstick the arrow.
My favourite, of course, will be the one I used 15 years ago in my arrowhead removal from Henry V.
And an excellent video that is definitely worth checking out later on. In that video, Kevin explains that Henry
Was only 16 years of age. He was at the Battle of Shrewsbury, charging down on his horse when an arrow hit him.
This event was reenacted on the Discovery Channel in a special years ago.
In the face. The courageous prince fought on until victory was theirs.
As you see here, Henry was struck in the face with an arrow beside the nose on the left side. Here, the zygomatic and maxillary bones form what is known as the zygomaxillary complex. In Henry's case, the bone was shattered, allowing the arrowhead to penetrate 6 or so inches into his skull.
And the head of the said arrow, after the arrow shaft was extracted, remained in the backbone of the skull.
What you've just heard is the description of the surgeon who tended to Henry. He was able to remove the shaft of the arrow, but not the arrowhead, which was either embedded in the bone or held in place by bone fragments.
Prince Henry was very lucky indeed. If the arrow had gone into the cranial cavity and had damaged his brain.
As Dr. Newton explains, we're within inches from several critical structures that, when damaged, could mark the end of a life. An arrow wound to the brain poses significant risks, including potential neurological damage affecting movement, speech, and vision. There's a high risk of infection, bleeding, swelling, and increased pressure within the skull, all of which can be life-threatening. Though, surprisingly, some have survived an injury like this. Pictured in a 2004 case report in the Journal of Rentgenology is the x-ray of a 22-year-old man with crossbow injury of the head. Sagittal multiplanar MDCT reformation reveals entire trajectory of the arrow shaft, shown by the arrows. Note that the aluminum shaft is hollow. But back to Henry, who would also have been in grave danger.
Or if it had crossed the midline, damaging the spinal cord and the major blood vessels around the base of the skull.
Our spinal cord, which lives inside the spinal column, is the information superhighway that transmits information from the brain to the body and vice versa. If it is severed, all motor function ceases below the level of the injury. Generally, the higher this type of injury occurs, the worse off the patient is. For example, spinal cord injury at the level of C3 or above can affect the function of the nerves that control the diaphragm, the primary muscle involved in breathing. Do I need to tell you what happens when you can't breathe? And don't get me started on the major blood vessels at the base of the skull, including the Circle of Willis, a ring of vessels connecting the anterior and posterior circulations of the brain. There is no chance that medieval medicine could repair these. We have difficulty doing so effectively even today. And since they're responsible for supplying oxygenated blood to the brain, without them, lights out. Now, apparently, as military historian Mike Lodes points out,
an arrow of this type, if it had come head-on into him there, at full power, would probably have come out of the skull the other side.
Since it didn't, Many believe the arrow glanced off another surface, losing speed prior to hitting Henry. How can a person be so lucky and so very unlucky at the same time?
The arrow has entered his face here, would have passed through these very thin plates of bone that form the facial skeleton.
Seriously, just think about all the vital structures that are in that neighborhood, including the pituitary gland, hypothalamus, and the cerebellum.
And come to rest against the more solid bone of the base of the skull.
The device used to remove the arrow from King Henry V's face was called a tongs. This tool was designed by John Bradmore, Henry V's surgeon, and obviously was specifically designed for extracting arrows, allowing an embedded arrowhead or shaft to be grasped securely and pulled through the wound, preventing further damage.
Here's the tool.
Oh, that's wonderful. It just looks as if it's been picked off the page, doesn't it?
Yes.
This is the piece that passed down through the wound, then, the smooth.
The slender design of the tool allows it to pass through the wound channel without causing more damage and insert into the socket of the arrowhead.
As that turns, then this opens out.
So that it will open up onto the socket.
And of course, Bradmore's working blind, but he is passing this down.
As you can see here, the tongs then open outwards to grip the arrowhead from inside the socket, effectively replacing the actual shaft.
He begins to turn the screw, and he would have felt the point at which this has gripped the arrowhead. I can feel there that it's firmer. Half their problem is to get the arrowhead out of the bone.
And once it's gripped the arrowhead firmly, Bradmore need only play a little game of operation. And voila, tongs to the rescue. Incredibly resourceful, but still painful as heck, considering there's an expanding metal screw some 6 inches into your face.
And then moving it to and fro, little by little, I extracted the arrowhead.
Unfortunately, in the 15th century, treatments for complex facial fractures like Henry V's fractured cheekbone were limited. Simple fractures might have been stabilized with splints or bandages, but for more severe injuries, especially in prominent individuals, more elaborate treatments might have been attempted. But I was unable to find detailed accounts of any reconstructive surgery taking place. In the absence of reconstructive surgery, the bones involved in a complex facial fracture might be permanently misaligned, which may lead to poor healing, cosmetic issues, chronic pain, or difficulty chewing or speaking. Some accounts mention that he did suffer visible facial injuries, including scars or a visible mark on his face. A small price to pay considering he walked away with his life. Shout out to all the incredible channels whose videos enriched today's lesson. And interns, please let me know what you'd like me to cover next in the comment section down below. And don't forget to follow me at my online gym, Hubie 2.0 Fitness, for free right here on YouTube, where we help you move better and prevent injury. Remember, to trial Brilliant free for 30 days, visit brilliant.org/Dr. Chris Raynor, or click on the link in the description down below. The first 200 of you who visit will get 20% off Brilliant's annual premium subscription. If you liked the video, be sure to subscribe to the channel and give it a big thumbs up to feed the algorithm beast. And if you didn't, be sure to let me know why in the comment section down below. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.